PIVOT-006 is a phase 3 randomized open-label controlled trial comparing cretostimogene against observation for patients with intermediate risk non-muscle invasive bladder cancer. The goal of this trial is to determine if cretostimogene will improve the recurrence-free survival for patients with intermediate risk non-muscle invasive bladder cancer. All the patients in the trial would undergo bladder tumor removal as is standard of care. Roughly half of the patients would be randomized to adjuvant treatment, which means treatment after the tumor has been removed, or control, which is observation. The patients that are randomized to cretostimogene would get treatment in terms of an induction period and a maintenance period. The induction period is weekly for 6 weeks. Maintenance treatments or cycles would be weekly for 3 weeks. And the maintenance treatment would be given roughly every 3 months for 1 year. The primary endpoint of the trial is recurrence-free survival, which means the duration of survival where there's no evidence of cancer relapse. It is an open-label trial, which means that the patient and the investigator will know which arm the patient is put into. So they'll know which, obviously if they're getting the drug or a control. So patients that are randomized to the control arm will also be allowed to get the drug if they experience relapse during the course of the study. In addition, the trial will assess patient-reported outcomes with regards to their quality of life and their symptoms to ascertain whether or not the drug has a significant effect on their quality of life and patient-reported outcomes as well. The trial aims to enroll patients, and this will be at sites across the country. There will be different avenues for patients to inquire about the study. Online, you can look at clinicaltrials.gov, which lists all clinical trials that are currently available, and you could get information from there. Also, the Bladder Cancer Advocacy Network, or Beacon, will have information about the study on their website. But I would start by asking your urologist if they're participating in the trial or if they know of a site that is nearby that you could participate in. If you're a patient with intermediate risk non-muscle invasive bladder cancer, you're currently facing a situation of uncertainty with regards to whether or not the tumor will relapse. And you will have some options to discuss with your doctor with regards to commonly used medications. But if you are interested in being a part of a clinical trial of testing this novel agent, this trial might be something that you would be interested in considering.